Hello, and welcome to a quick introduction into liquid biopsies. My name is Dr. Mike Preuss. I'm Senior Field Application Scientist from Personalised. A liquid biopsy, also known as fluid biopsy or fluid phase biopsy, is the sampling and analysis of non-solid biological tissue, primarily blood. Within clinical routine, other liquid fluids are also commonly used, like cerebrospinal fluid from the central nervous system, or saliva, pleural effusions, or urine. Here we will focus on blood only. Blood contains two types of cancer-derived materials that are susceptible to detailed molecular analysis: intact circulating tumor cells, CTCs, and circulating tumor DNA, ctDNA, as a fraction of the cell-free DNA. As tumors increase in volume, the capacity of phagocytes to eliminate and clear apoptotic and necrotic fragments can be exceeded, leading to passive release of cfDNA into the bloodstream. Physicians can use the blood run from a patient to analyze DNA that tumors typically shed into the bloodstream. Depending on the tumor size and vascularity, the amount of cfDNA released in the circulation can vary from 0.01% to 90% of all DNA present in plasma. Therefore, liquid biopsies provide a less invasive approach to tumor molecular profiling without having to obtain tumor tissue. Over the last years, for example, too many lung cancer patients experienced needless treatment delays because the genetic data arrives too late. In approximately one-third of all lung cancer cases, no genetic information from a tissue biopsy was available. Either the procedure is too risky, there was only little tissue available, or the physicians hesitated to perform multiple biopsies. With tissue biopsies, it is nearly impossible to monitor genetic profiles over the time. A biopsy is a procedure to remove a piece of tissue or a sample of cells from your body so it can be analyzed in a laboratory. If you are experiencing certain signs and symptoms, or if your doctor has identified an area of concern, you may undergo a biopsy to determine whether you have cancer or some other condition. While imaging tests such as X-rays are helpful in detecting masses or areas of abnormality, they alone can't differentiate cancerous cells from non-cancerous cells. For the majority of cancers, the only way to make a definitive diagnosis is to perform a biopsy to collect cells for close examination, like bone marrow biopsy, a skin punch biopsy as seen here on the left side of the slide, endoscopic biopsy, a fine needle aspiration as seen here on the right side, or any other surgical biopsy. Some procedures can be painful for the patient and very difficult based on tumor location, morphology, or the patient's condition. The use of tumor tissue biopsies for diagnosis, prognosis, and therapy selection will remain the mainstay in cancer genomics for many years. However, the addition of the less invasive liquid biopsies as an alternative in patients who are unable to undergo an invasive tumor biopsy allows for many clinical applications, including screening, early detection of mutations for therapy selection, disease prognosis, and drug response and resistance mutation detection, as well as monitoring. The ability to perform serial blood sampling provides a unique mechanism to monitor the course of disease without having to obtain tissues at frequent intervals. These are the main reasons why liquid biopsies become interesting in clinical oncology procedures and more important as a complementary technology for the traditional tissue biopsy. As we now know why liquid biopsies are relevant for clinical oncology, how does the Personalised liquid biopsy strategy fits in here? When you're really trying to build a comprehensive view of what's happening in the tumor, it's ideal that you have both the liquid and the tissue biopsy because there are elements of the biology that you can only see with one or the other. So that if you're looking for the full characterization of the tumor, the tissue remains important because you can access important information about the tumor microenvironment. You can robustly interrogate the RNA for tumor mutations, gene and immune expression signatures, and pathway analysis, sensitive fusions, CNV detection, and other variants, TCR alpha and beta clonality, and other important biomarkers as indicated on the left side of the shown Venn diagram, representing our ImmunoID Next platform. So we think that tissue sequencing remains very important because this kind of information can be very challenging in plasma. Our next liquid biopsy product is shown on the right side of the Venn diagram, and the liquid biopsy itself is also important because of the inter and intra-tumor heterogeneity. And we're really addressing that problem much more with the whole exome and 20,000 gene approach than others do with just small 10 to 500 gene panels. And of course, with liquid biopsies, you have a convenient and high compliance way of acquiring samples. It is also useful for the understanding of the biology in the context of evolving tumor dynamics in response to therapy, such as understanding how and why acquired mechanism of resistance emerge, clonal and subclonal evolution, how biomarkers and mutational signatures change, and how neoantigenes varies over time. So if you put these two together, ImmunoID Next and Next Liquid Biopsy, you can get a much better picture of what's happening in the tumor. Hopefully, this quick introduction in liquid biopsy provided you with the basic information and why they become more and more important in the field of clinical oncology as a great complementary technology for the traditional approaches. Thank you very much and have a great day.